2018 World Diabetes Day, and it said that no fewer than 425 million people in the world live with diabetes. And what's the implication of this? Well, financial and emotional toll on such families. That's the implication.
Absolutely, and we shall be looking at the situation back here in Nigeria. What's the statistics, how to deal with the disease, the management of it. Do we have enough access to medicine and the right medical experts to deal with it? Well, we have joining us at this time a professor of medicine and endocrinology, Professor Felicia Anuma. Felicia Anuma is also the Dean, Faculty of Clinical Sciences at the University of Abuja. Professor Anuma, good to have you here with us.
Thank you very much. Good morning.
We talked about statistics of over 425 million worldwide living with diabetes. What is the Nigerian statistics? Where does Nigeria fall in this statistic?
Yeah, Nigeria falls in these statistics because 4.5% of Nigerians, according to the International Diabetes Federation figure, have diabetes. And if you look at us, 180 million, 4.5% of that population, that is significant. Also, looking at local studies of the prevalence of diabetes, it ranges from 2% to about 15%, depending on where we are talking about. The prevalence is lower in the rural setup than in the urban setup, of course, because of what we do in the urban setup. We have places, cities where the prevalence is above as much as 15%.
What do we do in the urban sectors? That makes diabetes more prevalent in the urban areas than in the rural areas?
The risk factors for diabetes are more in the urban setup than the rural setup, because what we did in this country was, and of course in other African countries, we got civilized. So we civilized everything about us, and we began to acquire the diseases of civilization. Diabetes is a disease of civilization. Hypertension is a disease of civilization. We didn't used to hear about heart attack, strokes in the past, but it's a common thing on a daily basis in the emergency rooms of many teaching hospitals now. So these are diseases of civilization. They are lifestyle diseases. We call them non-communicable diseases, but they are lifestyle diseases because they are diseases we acquire, depending on how we live. So in the urban setup, for example, we changed our diet from the traditionally healthy Nigerian diet to the civilized diet. All right, fast foods. I mean, we all feel very classy when we go to this fast food, sports, and we take all the things they have there. The problem is that those things they have there, they are high in sugar, they are high in bad fat, they are high in salt. And when we take, and in the urban setup, we take a lot of things containing refined sugars. Refined sugars are sugars in their most easily absorbable form. So the moment we swallow them, they run into the blood and step up our blood sugar. Now, blood sugar has a normal range. Every time it's above what is normal, the organ in our body called the pancreas that produces, this famous chemical called insulin that takes care of, that makes us to be able to utilize everything we take as a source of energy and nutrition. We stress the pancreas. Oh, blood sugar is high. Let me produce more insulin to crash it down. So as we stress and stress and stress the pancreas over the years, at a stage comes, it gets exhausted. And when it gets exhausted, there's no coming back. Then everything we eat builds up in the blood, and we say blood sugar is high. Diabetes is simply when the body is unable to utilize glucose properly. So blood sugar builds up.
So what are the dangers, Professor Anuma, of not detecting diabetes early?
Well, it's very important to even look at the risk factors for diabetes. Very important, because prevention is the key in Nigeria, especially in our setting where we don't have national health insurance coverage is less than 5%, and diabetes is an expensive disease. The cheaper option we have is prevention. So it's important for people to know, because even the theme for our World Diabetes Day this year is, number one, the role of the family, in preventing diabetes and diagnosing early, and of course the role in the care of any family member that has diabetes. That's the theme for this year's World Diabetes Day. So aging is a risk factor for diabetes, because when we are young, we are on the healthy side of the spectrum of life, but as we age, there are certain changes that occur in the body that will tilt us naturally towards the disease side of the spectrum of life. Blood sugar will tend to rise with age. Blood pressure will rise with age. But if we want to remain healthy, then we must change behavior at some point in time. If we don't, then we will go the natural way. So as we age, even without a family history of diabetes or hypertension or stroke, we must step down the amount of sugar we consume, the amount of oil we consume, the amount of salt we consume. We must just step it down if we want to age gracefully. So the second risk factor is physical inactivity. In Nigeria also, as we get more affluent, the evidence is that we have, many servants now serving us in all manner of ways. We no longer move, we no longer burn any calorie. And for us to maintain metabolic health and remain healthy and age gracefully, we must burn whatever calorie we take in each day. We must move, we must exercise, we must, have a balance, because when we have an imbalance, then that's the beginning of problem. Weight is another risk factor. And in this country, there's a concept we have about weight, that it shows, that we are affluent. It shows we have arrived. It shows we are doing well. But unfortunately, medically speaking, weight has no advantage of any sort. Blood sugar will rise with excess weight. Blood pressure will rise with excess weight. So the beginning of this whole story actually is the fat cell. And how does excess weight come? It's simple economics. When our input is more than our expenditure, we have an imbalance that settles as fat. So these are some of the risk factors for diabetes that we need to address: our diet, how active we are, and our weight. And I want to give a little assignment to every listener this morning. Check your body mass index.
BMI.
That's your BMI, because God is a perfect scientist. For every height, there is an ideal weight. That's the way God has made us. So when we allow our weight to get beyond what that height is meant to carry, then we are looking for trouble. So everybody today, check your weight in kilograms, check your height in meters, and divide your weight by the square of your height, and you get your BMI. The normal BMI is 18.5 to 24.9. Any BMI more than, 25 and above, it means that individual has some work to do if we have to prevent these lifestyle diseases. Also, very importantly, is the waist circumference. Everyone, again, should take the simple tailor's tape, put it around your navel, and measure. Now, for men, the waist circumference should not be more than 40 inches. And for females, the waist circumference should not be more than 35 inches. If it's more than that, then we are accumulating fat here, and that's the beginning of trouble.
That's irrespective of your height?
Irrespective of your height. Studies have been done to prove that height has nothing to do with it. Okay? So if this is not more than 40 for males and more than 35 for females, we've accumulated fat here, and actually fat accumulation here is more dangerous than even the general one, because here is the evidence that diabetes is on the way, that hypertension is on the way, and the consequences thereof.
Professor, you've talked about urban lifestyle that exacerbates the risk factors of getting diabetes, but we are also hearing people say even our local diets, which you advocate for, is still not very safe anymore for us to consume. They're talking about the high carb content of these diets, and they're saying the Gary, for instance, which we're used to eating, no, you might not be eating that much, just go for wheat, processed wheat meal and the rest of it. Tell us about that. Is there any scientific study that proves that dependence or eating Gary as we used to eat it regularly, or any other carb-based diet like yams and the rest of it, predisposes us to diabetes?
I will tell you that we have healthy diet in Nigeria. I think the problem is having the knowledge on what to combine is the issue. For example, the Gary you mentioned, Gary is healthy because Gary contains fiber. For example, if you drink Gary without sugar, that's a wonderful healthy diet. You see, sugar. And what I mean when I say fiber, what people call roughage. Okay, now we can eat our yam. We can eat our pounded yam. For example, my patients who have diabetes, who love pounded yam, I don't stop them from taking pounded yam, but I show them the size of my feast. So it's about portion size and what you combine. For example, we have the plate of food in, moderate sized plate. what we say is that you let an imaginary line, put an imaginary line in that plate, dividing it into two halves. That one half is vegetables of any sort, as long as the name is called vegetables. And we have vegetables in Nigeria, don't we have?
Clearly.
We have all manner of vegetables in Nigeria. So half of that plate is vegetables, the ones you love, the ones you enjoy to eat. We're not specific about what type of vegetable, as long as it is vegetable. Now, the other half, you also have an imaginary line dividing it into two. So we have 2 quarters, isn't
Yes,
it?
sir.
Now, 1 quarter contains whatever it is you want to eat. If it is pounded yam you love, if it is eba, if it is amala, if it is semo, whatever it is, if it is rice, if it's beans, whatever. Now, the other quarter is the protein and fruit. Now, roughage has very important role to play in our food. Okay, we call it fiber. Now, fiber, when we eat food with fiber, what it does 3 things. Fiber is bulk. So it fills the space and we don't feel so hungry. For example, you take a bowl of soup and a piece of fish, for example, and you take water. You feel satisfied. You're not going to get hungry. Meanwhile, what the body is going to absorb as glucose is very small. So first of all, it is bulk. Then secondly, it delays the rate of digestion of the food you have eaten and delays the rate of absorption of glucose from that food. So your blood glucose is not going to spike up the way it will if you take a bottle of Coke. It's a gradual rise and then it levels off at a particular point in time. So we encourage that people take a lot of fiber in their diet.
Okay.
Okay.
What do you say to women who, because we've heard this before, I don't know, we're not trying to demarcate anything anybody's doing, but we hear a lot of women getting involved in diets they call keto diet, where they say, stay more with proteins, you know, take very little or no carbs, but take more proteins. How dangerous can that be?
Well, the keto diet became very fashionable at a particular point in time. And the reason why is this. You see, for an averagely active individual, my word is averagely active, that person requires about 3,000 calories as total intake in 24 hours. But if you are not averagely active, you cannot take that much because you're going to have that imbalance we talked about. So, maybe 2,000, 1,800. Okay? Now, the keto diet reduces calorie intake drastically to like 500. And if you reduce the calorie intake to that level, definitely there will be a rapid drop in weight. You know, when people say, I don't eat much, I don't eat much. But you see what they are eating, 2-3 people can conveniently take that. In fact, 5 of the 10 risk factors for global disease burden identified by WHO is physical inactivity, lack of vegetable intake, high BMI and all that. Food is a major risk factor. So if you drop it's like when you fast. If you fast for 1 week, you're going to drop in weight. So if you drop your calorie intake from 2,000, for example, or from 3,000 per day to 500, you will lose weight drastically. Now, but there's the other side to keto diet. Now, you don't take enough fluid, so the person is dehydrated. And when you are dehydrated, the kidney will not get enough fluid, so stones can begin to build up. Now, the amount of fat that is consumed is also quite high, that you may not be able to burn out. So when fat level is high in the blood, it blocks the blood vessels. And then that individual is at risk of, you know, heart attack, stroke, and so on. So and we even have what we call keto diet flu when this individual started immediately. So what we suggest is still moderation. Moderation in your normal diet, because the keto diet has its other side.
Okay, Professor Numa, you spoke about your patients. I know there's doctor-patient confidentiality. But on the average, why I'm asking this, that so that those out there can know, oh, these are the issues, this is what we need to be looking at. Different types of diabetes cases and stages. Yeah. But on the average, how much does a diabetes patient spend for treatment? Maybe someone who is an acute diabetes case.
Well, diabetes is an expensive disease. Just a short example. I had a 34-year-old Nigerian who was a graduate but had no job. We all know that's the situation. Had diabetes for 12 years. And because he had no job, no money to get his medication, control was poor, so he developed complications. 2 years before he came to us, he already had an amputation of one limb. And he came to the teaching hospital with a very terrible wound, ulcer on the other. And we thought, and he came with no money. And we had to be contributing money, in the unit to manage this guy. We thought we could salvage that limb, but a stage came, and with the orthopedic surgeons, the decision was, if this individual has to leave, then we have to get rid of that. He refused and said no. Rightly so, a young man not married, without limbs. We were doing that. Unfortunately, one day I got to the ward, on my ward round day, I saw an empty bed, and I asked the matron in charge of the ward, where is this guy? And he said he died yesterday. This is the plight of the common Nigerian with diabetes. Now, diabetes, for you to properly care for diabetes, get the medications, check the blood sugars frequently as you should, and so on, screen for complications, that individual may require almost 50% of his income monthly to do that. And that is why the International Diabetes Federation, the theme for this year again, they are saying the family and diabetes. The family needs to be educated to support this individual with diabetes, because apart from financial support, they need psychological support, they need emotional support, and so on. So it is, if one person has diabetes in the family, is a problem of every member of that family. And when the complications come, for example, an individual has kidney failure from diabetes, in the Nigerian setting again, that is a death sentence you have hanged on that individual. Because even if it is dialysis that this individual needs to do to remain alive, this person needs an average in our setting of about 100,000 per week to live. So that's a very expensive life. You and I can check how many Nigerians can afford to keep on with that kind of life.
100,000 naira every week.
Yeah,
Is there government can do to make it easy for patients, people living with diabetes, to manage the disease?
The government can do a lot. Number one, they need to invest in education and prevention. It's very important. Our people say prevention is better than cure. And in our own setting, indeed, we need that. Because the first and cheapest approach for us is to educate people, is to empower people about the risk factors for diabetes and prevent it. For example, family history. If an individual has a parent who has diabetes, that individual has a 40% chance of developing diabetes at any stage of his lifetime. If both parents have, that individual has as much as 70% chance. Wow. But I'm always telling people that you can make use of the 30%. You can make use of the 70% by getting well informed, getting empowered to live right and not to have it. So there's a lot of education that we need, because I see a lot of ignorance out there. So there's a lot of, the media has a big role to play in educating Nigerians on the risk factors for diabetes and how to prevent it. 80% of diabetes is preventable. If only people know. So government need to invest in education and prevention. And then secondly, those who have diabetes, they need help from government. There's some legislation on on drugs medication, because medications are very expensive, particularly the newer ones that are better. They are very expensive and beyond the reach of many Nigerians. So government can actually subsidize medication, for people with diabetes, or even can afford to be one of the diseases to be treated free for Nigerians. So there's a lot government can do to support and help.
All right. Okay. Dr. Professor Felicia Anuma, this is Talking Education, and you've educated the viewers enough. Thank you so much. For the sake of humanity, you keep doing this.
Thank you.
Thank you so much. And keep up the good work. Professor Felicia Anuma is a Dean, Faculty of Clinical Sciences, University of Abuja. She's a professional in endocrinology. Pleasure having you here.
Thank you very much. Okay, now it's time for us to take our last interview on today's edition of the program. So stay with us. We will be right back.